Well, hello and welcome, ladies and gentlemen, to our very first show, our new segment with the man, the myth, the legend, Dr. Reginald.
The script.
Dr. Reginald D. Rice Jr., MD. Oh, yeah. The man himself.
Oh, my goodness. He didn't tell me he was going to do that.
Well, it's great. I got to put my phone away now after I did the air horn. Hopefully it didn't blast everybody. I'm John. This is our new segment, Dear Dr. Rice. You want to tell them a little bit about?
I need my jingle.
Oh,
Where's
yeah.
my jingle, Katrina?
It's coming. Maybe another 6 months we'll have a jingle for this
6
show.
months.
Yeah. So why don't you? What are we doing here? Why do we have this show, Dear Dr. Rice?
Well, we wanted to just give an opportunity for people to ask me questions in a public way. Sometimes patients don't want to come in and sit in a room with me. I won't bite.
I do.
Promise.
I take every chance I get. Let's make a show so I can sit in a room with you.
So yeah, so it's an opportunity for me to just give people in a broader audience information about what I do, how we do it, why we do it. So that's kind of what we're trying to accomplish here.
Yeah, I'm excited about this show. We're two males, obviously, but it's kind of fun to get the male perspective. Yeah, you can tell by my beard. It's kind of fun to get a male perspective on Botox, on filler, on plastic surgery. And so I'm excited if you know, you want to know what men think about Botox or
Brotox.
Brotox,
Yeah.
CEO talks, as I like to call it. We both use it ourselves, addicted.
13 years.
13 years. Wow.
Mm-hmm.
That's awesome. I've been using it for 4 months. I'm already addicted. So let's tell the people a little bit about you.
I'm a board certified facial plastic surgeon. I've been in practice for 23 years. Amazing. It's been that long, but yeah, 23 years. I've done thousands of cosmetic surgeries. I specialize in facial plastic surgery. My background is in otolaryngology head and neck surgery, which most people don't know what in the world that is, but that's ENT. And interestingly enough, ENTs were the first plastic surgeons. Back before there were a lot of specialties, the ENT specialty was one of the first. And so you had plastic surgery only if on the face. So it was the ENT doctors that did that. So general plastic surgery came along in the 1970s, so not that long ago, but we focused on the face. I spent my entire career on the face. So
Yeah.
that's why I enjoy doing what I do, is it's in my area of expertise.
You're in your element. I mean,
Yeah.
this is a doc right here who's done 10,000 hours. You want to talk about Malcolm Gladwell's 10,000 hours? I mean, 10,000 hours of blepharoplasty, 10,000 hours of, all these different facial surgeries. A true expert, and so that's why you see our how we talk about the face place. That's why we say that, because this man right here, thousands of hours in surgery. His last one, I think, ended 3 hours ago. So, yeah. So our first question, starting our episode off here.
Mm-hmm.
I was talking with a patient the other day, and she wanted me to ask you this. She said, if I could spend ideally $3,500 or less, so that's number one, no scalpel involved, and just one procedure. So I don't want to do a series, just one procedure, no scalpel, $3,500 or less. What would be your best recommendation to get the most results possible?
Well, I think that's actually pretty easy.
Okay.
I think it is carbon dioxide laser skin resurfacing.
Okay. Also known as CO2 laser.
CO2 laser resurfacing.
And why is that?
Because if you look at what happens when we age, the fact that our skin, our complexion gets splotchy, we get fine crepey lines and wrinkles, and we have some sagging. The one tool that I think can come to bear against all those issues at one time is the CO2 laser resurfacing.
Gotcha. So you talked about crepey skin,
texture, tone,
tightness,
even tightness.
Does it fix jowls?
Yes, it can. Now,
Okay.
I usually tell patients that you get about a 10-15% facelift effect from doing CO2 resurfacing.
Sure.
So you can't compare it with doing a mini lift or a facelift. But man, that's nothing to sneeze at. It definitely can make a nice difference in it kind of shrink wrapping the skin a bit.
Yeah. Yeah. So the results, let's talk about the results. This is one of my favorite procedures to see in the office too, as far as results. And it's interesting because we do facelifts all the time. Some do CO2 laser, some choose not to do CO2 laser. Any facial rejuvenation surgery, though, there's such a big difference when you add the CO2 laser.
That's it.
So why is that?
Well, because it targets the complexion.
Mm.
I mean, when you look at somebody, if what you don't want to see is anything, you want to see a uniform complexion. Because when it's uniform, it looks youthful. If you look at a baby's skin, for example, when they're infant, they got this perfectly uniform skin.
Mm-hmm.
There's no bumps, there's no pigment, there's no anything that distorts it. And that's a very youthful thing. So
Sure.
That's what we're after, is to make it as uniform as possible. So when you're, and it doesn't treat sagging like a facelift would. So
Right.
it does complement facelifting in that circumstance where somebody has too much sagging skin to improve with the laser.
Sure.
But for the complexion itself, it's just the tool.
Okay. Can you give us, in a way that a fifth grader might understand, because I know this is a very complicated technology, how does this CO2 laser work exactly?
Well, lasers hit certain targets, and the target is water with the CO2 laser. And what's nice about that is that the skin has a fairly uniform amount of water in it.
Sure.
It's not quite as much as the general, the normal statistic that you learn in high school biology is that we're 76% water. The skin's not quite that high, but it is fairly uniform in how much water is in the skin. So we have a fairly uniform target to hit. So what the laser does, when it hits water, it causes on a microscopic level a little vaporization of that water. So it lifts off what's over it.
Sure.
So just a very microscopic zapping, so to speak, off of that surface, whatever it is that you're targeting, brown spot or skin in general.
Yeah.
So that's what it does, is it lifts it off. Now it does so because it turns it into heat. Vapor is heat.
Mm-hmm.
And that's the other advantage of the laser, is when you heat the dermis, which is the mother layer of the skin. You've got the epidermis on the top and the dermis beneath. When you heat the dermis, you trigger a whole bunch of great things from a skin rejuvenation standpoint. You deposit, it's called neocollagenesis, where you put new collagen into the skin.
Gotcha. So let's talk about the thing that everybody's afraid of, and that's the downtime, the healing.
Yeah.
A lot of people might be sitting at home and maybe they've seen some photos after CO2. I've heard it looks worse than it feels.
It can be rough.
Tell us about the healing process of CO2 laser.
Well, again, I think there's the best way to do it,
Mm-hmm.
and that is just to do it. You can try to get to the end point in smaller bites. And I think there's an approach that I think is reasonable to do that. But if somebody, for instance, is coming in for like a global facial rejuvenation, so they've got sagging and they've got sun damage, then combining them at the same time makes good sense. They're one operating room, et cetera, et cetera. So the downtime is something that I say is directly related to the energy that we put in the skin. So if we're going to try to spread this out, we're going to do lower energies. The downtime isn't going to be as long, but you're going to have to do more than 1 or 2 sessions.
Gotcha.
So again, back to me, what I think is just get it done is, if we use the higher energies, you're going to get a longer downtime. But you can directly relate the downtime to the results.
Gotcha.
Meaning if somebody has a longer downtime, if I use higher energies, they have a longer downtime, they're just going to have a better overall consequence because there's more remodeling that's going on.
And I think a good way to think of it too, if you want to go big on the CO2 one time versus small 3 times,
that's it.
Is do you want to have 5 days of downtime 3 times, or do you want to have 7 days of downtime 1 time? So in the long run, it's probably less downtime. But I will say our esthetician Ginger, who most of you know, many of you might know, she had the CO2 laser on Friday with Dr. Rice, and they did what we call the lunchtime CO2 laser. I'll be honest, by Monday, she was still a little bit peely. By Tuesday, which was yesterday at the time of this filming, she looked totally normal in the sense of it wasn't like, Ginger, you look so scaly.
Yeah.
She covered it up perfectly today.
Yeah,
you wouldn't know anything's wrong today.
Well, what I'd like to maybe segue into is what modern CO2 laser resurfacing looks like, because CO2 laser has been around probably 15 to 18 years. It's been around a while, but there's been some things that have changed it fundamentally, and fractionation is one of those things. But then the other thing that make it, I think, better nowadays than it has been in the past is the fact that we can do things like what you alluded to with Ginger. We can do cover-ups much better. For instance, oxygenetics. Oxygenetics is a oxygen infusion makeup technology. It's a makeup line, but it's also can be used as a dressing in resurfaced wounds. So something like that that's been tested scientifically to be safe to put on wounds gets you back early. But there's also a number of things that we can do to make sure that you are minimizing the downtime and maximizing the results.
Gotcha.
So the prep regimen that we put patients on, I think that's really important. So in fact, I've had patients who came in wanting resurfacing. We put them on the prep regimen. They get to the end of the prep regimen, which is typically about 6 weeks, and they say, you know what, I'm really happy with my skin. I think I'll wait on that later.
Sure. And that's the Obagi system.
Obagi is the most common one that we recommend.
Gotcha.
There might be some tweaks to exactly what the new derm system involves.
Right.
And then, so prepping the skin, it makes sense because that recruits the cellular machines for healing.
Right.
It also can suppress some of the inflammatory or irritation issues that might be in the skin already.
Sure.
And then things that we do afterwards, we use epidermal growth factors. We use something called CE ferulic, which is just good topical agents that have been shown to really speed the recovery of, quote, injured skin.
Gotcha.
So putting all those into a program with a very regimented step, I think is shown a big difference for patients. Their downtime is less, their results are maximized.
That's great. Well, I hope you enjoyed the very first segment and until next time, live confidently.